Hey, this is Mike Sewell here with Asheville on Bikes to talk with the community today about how we might be reorienting our public right-of-way as a step to emerge from our current pandemic. I'm joined here today with Dr. Elizabeth Medlock of Results Consulting. She's a psychologist, consultant, and coach with the mission to help people and organizations do good better. She has experience in public and community health planning and evaluation and has facilitated and served on task forces, including post-disaster recovery. She lives in downtown Asheville for the last 3 years and is the chair of the Transit Committee and vice chair of the Multimodal Transportation Committee. My other guest is Michael Stratton. He is a native of Western North Carolina. He grew up in Waynesville. Michael is a pedestrian advocate, a realtor, and the chair of the Multimodal Transportation Commission. So, Michael and Beth, welcome to our online conversation.
Hey, Mike, thanks for having us.
Yes, thank you so much. We're glad to be here.
Well, I'm glad that you two are joining with us today. We have a topic of conversation, and that is a series of maps that members of the Multimodal Transportation Commission collaborated to produce. Asheville on Bikes released those maps today on our website, ashevilleonbikes.com. And could you tell us, Michael, a little bit about what these maps are, how they were produced, why they were produced, and yeah.
Yeah, well, I'd like to say thank you, number one, for having us. This discussion is, I think, really important for our community to have right now. And I'd like to also say that I'm not representing the commission right now. We are completely temporarily disbanded. I don't know if that's a correct term, but we are not sanctioned to meet currently by the city. So the maps that we've put together, the conceptual maps that we've created, have really been a conglomeration of private citizens that just happen to kind of eat and breathe a lot of this stuff. And we'd come together a few weeks after shutdown, basically. On March 16th, I believe, we were told by the city there's no more meetings, no more commission meetings, nothing. And there was radio silence for a little while. Completely understand that. They were in action crisis management mode. But at the same time, we have very, driven citizens here in Asheville, which is a really good resource to have. So in that, that bit of a vacuum of communication, I'd reached out to other members and said, hey, there's other cities across the United States that are implementing measures that look very similar to, what we should, think about here. So initially, it started out by me sitting in front of the computer and literally highlighting some areas and just spinning it off and say, hey, what do you think about this? And what do you think about this? But, at no point have we operated as a quorum. This has all been like spoken wheel methodology where as a chair, I kind of just act as a facilitator of conversation and say, hey, what are you talking about over here? What are you talking about over here? And through that methodology, we kind of took an initial idea and developed a larger concept. It seemed to get a lot of traction. Every time we brought it up with folks in our community, we got a lot of really good response. I'd floated the idea when we had a retail Zoom conference that the chamber had put on, and I got a lot of good feedback from that, including from Esther Mannheimer. So yeah, it's been unorthodox, and I know that the city's working on their plans, which we'd like to see those too. But in the interim, we've put together a concept that the city and our community can kind of sink their teeth into. Is it perfect? No. Are we asking for feedback to make it perfect? Yes, and that's why we're here today.
That's great. So, produced by members of the Multimodal Transportation Commission, but not a work product of the Multimodal Transportation Commission.
No,
that's
no.
that's really good.
Ideally, you're right. No. Ideally, our typical scenario is we have input from staff. We have the ability to set an agenda. We have a liaison with the city council, who ours is Gwen Whistler, vice mayor. Typically, we have a lot more resources at our disposal to operate. So it's been very much of a just kind of like I said, just folks talking.
Sure, that's great. And Elizabeth, what has been your role in producing these commerce maps?
I kind of took the perspective of being someone that's been on post-disaster and public health planning task force in the past. So I kind of brought my public health planning knowledge and experience of best practice also and lived and worked experience of implementing things like this to really put a lens on it of what do we need to do to live and work and engage in commerce in a way that in this pandemic we can be aware of the health and safety measures that need to be in place to keep us all safe. And then also, part of this is, as Michael said, many of us that are Multimodal Transportation Commission do our own personal advocacy. We are very much bike advocates, pedestrian advocates, transit advocates. And I live in the middle of downtown Asheville. And so a lot of it was just my experience and the things that, quite frankly, have kind of needed to go on for a while to really help us to live and work and move around areas of Asheville more safely.
That's great. So this is really, I mean, it's like citizens lending their professional experience and their passion for our city to put some ideas down on paper for the benefit of our community, to be reviewed by the community, to be refined by the community, to be criticized by the community. But let's get some ideas out there. So with that, I want to thank both of you for leading this and getting these maps created and out and about. So let's jump into the maps right now. The maps are, of course, entitled Asheville Social Commerce Zones, the SCZ proposal.
It's actually safe commerce zones.
Okay, excuse me. So yeah, let's look at map 1, and can both of you give us an overview of what this is? I see some red lines and some green interesting shapes. Can you break it down for us? Just a quick overview.
Yeah, Elizabeth, do you want to take this, or do you want me to dive in?
Yeah, dive in, and I'll kind of. I mean, this is my neighborhood, so yeah, okay. Go ahead, Michael.
Okay. So yeah, what you're looking at is a concept, and let's keep this. I'm going to say this probably 100 times throughout our conversation. This is a conceptual rendering, in the same way that when Ford, puts out a concept car, the final iteration is generally much different. So what we're showing is an example of what things could look like. Are the zones that we're proposing, stuck in stone? By no means. No, absolutely not. But what we have done is try to identify some likely candidates. And what you're looking at is the green areas would be pedestrian prioritization zones. So these are zones where you might have some reconfiguration of traffic. You might have sidewalks be extended out into where there would have been perhaps 2 lanes of traffic going in an alternate. Maybe in these zones you have 1 lane of traffic, and you've got extended sidewalk as well as curbside dining in an area that would have normally been, given over just to traffic. So the goal here is to create different zones across our community where commerce can safely happen. That's why we're calling them safe commerce zones. And when I did some research on this, it looks like some communities have thought, okay, we'll do 1 pedestrian prioritization zone in town, and what they found is that can actually be more dangerous than if you were to put multiple of these zones across town. So this is actually kind of a zoomed in version of Asheville. And it doesn't reflect some of the other commerce zones in town that could also be included, and in particular the River Arts District, perhaps Biltmore Village, and the goal, would be to allow for these zones to be connected by safe routes. And when I realized that Mike was working on a safe route connector, it made a lot of sense. In fact, just by default, we didn't even share notes. His safe route kind of touched a lot of these zones. So as far as what you're looking at, I think some of the other slides moving forward can get a little bit more detailed. This is a little bit
more. This is more of an overview. But so when people see those green shapes, that's a commerce zone, and the idea is to create a variety of these commerce zones so that businesses can operate outside in safer conditions. Additionally, a commerce zone, if I'm understanding you correctly, a commerce zone creates more space for the pedestrian experience so that pedestrians can be visiting businesses at safe social distances, that there are adequate spaces for pedestrians to move about. And to sort of recap, the third thing I think you were sort of getting at is that we have to look at this concept throughout the city so that we don't create an event footprint and where we have all people from all over the city who are so anxious to get outside concentrate themselves in one area of the city. We want to, you're suggesting that we give people a variety of places to go so that we can maintain safe social distances as we open commerce up. Is that correct?
That's absolutely correct. It comes from two different vantage points. The first being just health and safety. We don't want everybody flooding one zone, so you want to make these ubiquitous throughout town. But more than anything, and equally as important is we need to look at this through the lens of equity. So this can't all be just a downtown Asheville project. This needs to be a community project where these are spread, everywhere, including West Asheville, South Asheville. If we can make that work, I'd like some input from folks down in South Asheville. I know they've got a little bit different. They've got some more challenges in South Asheville. When you get below I-40, it's not as conducive to walkability. It just wasn't built out that way. So the maps that we've envisioned, they kind of start with where's the easiest place to implement it, and then how do we phase that out and get it to a broader spectrum of Asheville.
Great. I wonder if we could hop down to page 5, and it is map 2B. And in the top right corner of that map, you sort of see how the streetscape has been changed. College at Pritchard Park now, and then you also have College at Pritchard Park proposed. And could you tell us a little bit about that design change?
Yeah, so I really like these, and this is where we were able to rely on some of the really good expertise from within our own group. We were able to put these maps together based off of, I think it's called Street Mix. So the idea is here that we have enough room to do everything, potentially, that we want to do. We have enough room to allow traffic to continue to flow. But because some of our thoroughfares are relatively wide, for instance, College has multiple lanes of one-way traffic. During a pandemic when we don't have a whole lot of traffic to begin with, it might make sense to take one of those lanes and convert it over to sidewalk or additional space where we could either have sidewalk or bike lane or even dine-out services. But in this particular example, you see what the iteration would be where you take multiple lanes of traffic and then you pare that down and give more to walkability. And there's just more room at that point for people to space. And it's highly needed. I don't know if you guys have had an opportunity to go downtown this weekend over the holiday. There's not enough room under the current setup to safely social distance. A lot of people in the attempt to social distance will go out into the road that's currently active with cars, just so they don't have to walk too close to people. And we're very early on in our tourism season, so we want to make sure that we're creating a space downtown where commerce can happen, tourists can feel good about being here, and more importantly, our locals feel good about making it into downtown safely. I know
Yeah,
now.
well, Beth, you are a downtown resident, and just can you basically or briefly touch upon what has been your experience as a downtown resident in the past few weeks and over the weekend when our businesses started to emerge?
So what I want to share with folks is my daughter and I have been collecting actual data in downtown Asheville, which we've been putting out broadly, also sending to our county commissioners and our city council. We've interviewed over 200 people and looked at things like ability to physically distance, how safe people feel, where people are coming from, what they're doing downtown. And we've done that 3 consecutive weekends. We collected data again on Saturday. I can tell you that 29% of the people that we interviewed wanted there to be more pedestrian thoroughfares and wider sidewalks. And the majority of these folks this weekend were actually tourists. We were at only 24% of the people we interviewed were locals this weekend. So already we're seeing people that are saying there needs to be wider sidewalks, more pedestrian thoroughfares. We're seeing people walk in the streets. That was happening all over the place this weekend. And we're seeing that there is, when I walk out my front door, I live on Biltmore Avenue, right next to the Mass General. It's called the epicenter of chaos sometimes, but we can't walk out right now the front of our building or the back of our building on South Lexington without having to dodge people. It is pretty much, I would say, Memorial Day weekend was clearly very, very difficult to get 6 feet of distance. And I think that was really the impetus for a lot of the work that folks have been doing, is because we knew there was going to be this influx of folks all over. And we wanted there to be opportunities for people to move about safely with doing the physical distancing that they needed to do, so that they can go into restaurants and they can go into retail safely. And I could say that was tough this weekend.
Right. Right. And so the idea again is creating space for businesses that operate outside, and creating space for pedestrians to flow safely throughout their city, throughout their homes, and to visit businesses. And we know that people are coming here for the weekend. So if you're creating space for businesses to operate in the right of way, and you're creating more space for pedestrians to move safely about, something's got to give in the right of way. And how does this proposal impact vehicular travel and on-street parking? How do you reconcile all of these things?
So I don't know if you guys had an opportunity to watch City Council meeting last night, but one of the things that I gleaned was a comment made by Barbara Whitehorn, and she alluded to the concept. They were talking about how much revenue they're losing right now because of the lack of on-street parking metering. But she said, look, even if we turn that back on, you're not going to see full parking decks and full full Asheville right now. So, we, and as businesses are being told to operate at 50% capacity or 25% capacity, it just suggests that the parking that we had in the past might not all be in need right now. So what we tried to look at when we created this concept was to think, okay, if we were to do these safe commerce zones, how do we get them very, very close to parking structures? So the way these operate is you would incentivize cars to go to specific parking areas, and then from that point, they can enter into the safe commerce zones. So it would be very similar to the experience that people have when they go to the mall, for example. When you go to the Asheville Mall, everybody goes to the big parking deck that's right next to the JC, I guess it's the Belk. And then at that point, people go into the mall and they end up walking for half a mile to maybe a mile sometime. So what we're suggesting is a very similar concept.
Okay, so we're going to move things around, prioritize parking in the parking decks, and then if we go all the way down to map 6, I believe it is, on page 10, we also have the circulator, the active transportation beltway. So you have fewer cars moving into downtown, but maybe one way to compensate for less vehicular traffic is to welcome more people from adjacent Asheville neighborhoods and communities to come into the city through active transportation by biking and walking. Is that correct?
Yeah, that's absolutely correct. And this morning I actually went on a 9-mile run just from my house here in Oakley and was able to do most of that circulator myself just on foot. Unfortunately, it wasn't safe, which is why I wear a very, very bright yellow shirt. I do a lot of hand communication with cars in the same way that bikes do. But, we don't live in a huge city. So if we give people the mechanisms to get to some of these commerce zones, I think they'll take it. And to Elizabeth's point, our downtown right now, as it is really mostly being visited by tourists, with only 20% being local, I think. So we need to get those numbers up to get our locals able to enjoy our city.
Yeah, I think that's right. I definitely think I'm a visually impaired person also, so I walk all around Asheville, and I do think that what we're really trying to do is connect people to different areas to enjoy the abundance we really have here in Asheville. We have so many unique and interesting places in Asheville to go to, and I think if we can move people around more efficiently and more safely, especially in this time of pandemic, people will take those opportunities to come into these different areas and enjoy them and shop and eat and walk around. And you're right. Right now, we don't see a lot of locals coming downtown. And I do think, our thinking on this is to promote people coming into these commerce zones and feeling safe in them.
I'd also like to point out that our buses are operating on a very limited capacity. So if there's 10 people in the bus, they're full load at that point. So there are a lot of people who've been reliant on, our bus because they didn't have the opportunity to safely, bike to work. That's just not an option in this city at this point. With looking at it through that lens, we need to be thinking about other opportunities for people to safely get to and from different parts of the city. Right now, it's only been car and bus, unless you're in a bright yellow shirt and okay with taking the risk to get hit by a car.
So once you have 10 people on that bus, and that bus is generally, that's at capacity. So really looking at other ways. I know from my work that there are more people on bicycles than ever before in the United States. There are lots of people that are pulling their bicycles out of basements and getting them tuned up. Personally, I've also have given away a few bicycles. People have called me. I keep a sort of a stash for long-term loans. So by creating a series of slow streets and welcoming people in, it kind of makes sense. I know that, obviously I live in Asheville, and our summer plans have been interrupted by COVID, and the things that we were going to do, we're not necessarily going to do. We're going to be here for the summer. So it's a real opportunity to really dig in to Asheville and get that local experience on a bicycle. And going through these maps, this concept, this proposal, it seems so grand, so big. It's a little overwhelming to think about the implementation of this or a piece of this. And we also think about, potentially road construction and how you're reorienting the public right of way. What's some guidance or some suggestions on how we would begin to implement a slow street network, a commerce zone? What are the models telling us of places who have done it?
Well, I'd like to just reiterate that what we put together is very much the scaffolding. This is a concept. It's the scaffolding of an idea, and why we're talking about this right now, and why we hope that the public would get engaged is with the hope that they can put the skin on this thing. There's going to be a lot of unanswered questions, and the other folks that have worked on this don't have the resources to answer every single one of those questions. It's going to take active engagement from the city, which I know that they're working on iterations of this now, but it's also going to take input from the public. So, that's why we were very adamant to say it's conceptual, because when you go drawing lines on papers, people are going to say, well, what about the effect that it's going to have on my business? So we have to hash all those things out. But what we can do is we can look at other cities that have implemented these type of things, emergency things. We don't have to reinvent the wheel. I think a really great example is the Oakland example that you'd shared, where the city had put out a map and said, hey, in these areas, in these zones, cars are going to take a back seat because we have so many people that are stuck at home and need to have some space, and they need to have safe space to do so. Here's the map, and it was very much of a community effort to implement the thing. So it's going to take buy-in from all constituents, not just any one of us on this call.
It's a wide
Yeah, and I'd
community.
also
Go ahead, Beth.
Yeah, I think we definitely need community buy-in, but I think the point that we should make too, people ask, wider sidewalks, do we need to pour concrete? And the answer is no, you don't have to brick and mortar these things. That there are temporary structures and ways, and there's really good guidance at the national level and at cities that have done this, that you can put in short-term temporary structures and you can put them in quickly. So the idea is that when we do get community input and we do work these things out, that we can mobilize quickly to put structures in place to make the modifications.
I think that's
Right.
really important to highlight, and I'll have to concur with that. What we're dealing with, and Mike, we were discussing this earlier, and I loved your characterization of this, but this is triage. This is fast and quick. And save our souls scenario. So that means maybe you'll see some caution tape, maybe you'll see some sawhorse fixtures put up or maybe some cones. But I think the uptick is that once people are safely within these zones, they're going to have a much more rich experience than they would have otherwise had if they're trying to dodge people, or you're walking next to the person that decided not to wear a mask today that's coughing, through their hand. I'd much rather have the ability to sidestep that person into the public right of way into the street than if I was confined to a 4-foot sidewalk, which is very ubiquitous across Asheville. We came into this with some of the worst pedestrian infrastructure in the state, if not the country. And we've already led in terms of traffic fatalities and collisions here. So knowing that we were already kind of behind the 8 ball, when you compound it with COVID and distancing, we need to make some real quick moves.
Right, and I love the tactical urbanist guide that's being shown right now. The idea that this is really triage and temporary. We're talking traffic cones and some sawhorses. We could even spruce up some old tractor tires and get them out there in the right of way to define the space for people and commerce, and vehicles are able to use the road, but vehicles are guests. The prioritization here is the safe, predictable movement of people. I think this is a really exciting concept to introduce to the community and to share with city staff and our political leaders and our business leaders. Someone who's watching this and is inspired and wants to participate, what would be the next step for community members, business owners, organizations? What would be their next step to participate and to do what you all are doing, which is sharing in the heavy lift of emerging from the pandemic?
Well, we were really happy that the city, when we shared this with them, and we shared this with staff, we shared this with city council, and I think when they saw the scope of it, they got excited too. And within a few days, they had put up a portal on their city website that allows for comment and feedback on this type of stuff. So initially, what they were working on were the curbside pickups, delivery zones, and you can go ahead and provide feedback on those two bullet points today. But I've been told by staff that over the next couple weeks, we're going to start to see more engagement and more of an upfit on their website, where you can see renderings like this. It won't be specifically these, who knows? But hopefully they have some sort of renderings up where they can kind of get the message across, and you can make public feedback there. So we're hoping that this gets expedited quickly, and we're hoping that the public knows about that portal so that they can add their comments and their feedback. Because without it, we're going to have a model that's not quite right. We need that engagement.
Yeah, I also think that it's not only giving feedback about what it could look like, which I think is critically important, but it's also giving feedback that it needs to happen quickly. So I think there is an opportunity for the public and the folks in this community to come together and say, let's get this done, and let's get it done now. And also, if we're really, truly all in this together, I think it's going to be all hands on deck moving forward. And any way we can utilize the massive amount of skill that people have here, the passion that they have for Asheville, we really need to kind of get folks together on this. Let's get out there and do some of this stuff and put the cones out. And I can see the community coming together around some of these projects. Have a socially distanced, beautiful Saturday, putting some tactile urbanism in place.
Well, that's really great, and I want to thank Michael and Elizabeth for taking time today to go through their proposal. I want to thank you and the other members who participated in putting this together and sharing it. I mean, you are exemplifying exactly what our city needs at this time is innovation, people willing to roll up their sleeves and put some investment of their time and talent and find a way forward. So thank you for doing this work. Thank you for sharing it with city staff and our political leadership and being the exceptional citizens that you are. I think your actions point a way forward for our city. So thank you very much for your participation.
Well, we appreciate everything that Asheville on Bikes does. It was really evident when we started to come up with some of these concepts that we were very, very much in alignment with, I think, what you guys were similarly tracking at. So I think, it's really important for the grassroots work that you guys do and the following you have. You guys can share some of this out there, and we can get that feedback that we need for the city to move quickly and expeditiously.
Yeah, I want to thank you so much, Asheville on Bikes, for putting this together and for the work that y'all are doing. And I believe you guys have a portal too that people can share feedback. And I thank you for that work and for being a point that people can coalesce around and move forward with all this.
Great. It's a teamwork, right? It's we got to keep the wheels in motion and we got to keep moving forward. So thank you again for your time. And you can go to our website, AshevilleOnBikes.com, and download these maps. We also have other resources available that show what other cities have done to respond to the pandemic. Then we've also have a agency, the National Association of Transportation Officials, an agency that's near and dear to my heart. They just published a document, Streets for Pandemic Response and Recovery, that provides some excellent guidance. So again, let Elizabeth and Michael inspire you to dive into this, and let's really think about how we are going to work together, share in the heavy lift, and save our city. Again, Michael and Elizabeth, thank you so much for your time today. I really appreciate all the work that you're doing.
Thanks, Mike. Have a great day.
Thank you.